inflammation, so it is going for pain, redness, swelling, all these things going for the inflammation. Is or no? Yes. Now, inflammation can be, what will be the cause for this inflammation? Idiopathic, maybe unknown cause. Secondary infection, already in the last slide I told you the infections, no? Viral infection, bacterial infection. Now going for the autoimmune disorder, third one. Autoimmune disorder is multiple sclerosis. Already we have learned about the multiple sclerosis, yes or no? Neuromyelitis optica. And fourth one is post-vaccination or post-infection. So what is post-vaccination? Set of people going for a vaccination. If that vaccination is not so suitable for the particular patient, okay, or a person, it will convert into the inflammation process. That is the autoimmune disorder. It will trigger the autoimmune disorder, which may attack the myelin sheath of the spinal cord or the CNS of the brain. If it is affecting the CNS of the brain, what is the condition? It is multiple sclerosis. If it is affecting the spinal cord, transverse myelitis. Understood? Yes. Now going for the second one. It is the demyelination. This is the second stage of the pathophysiology. First, inflammation has caused. And what are the causes we saw? Going for the demyelination. What is demyelination? The myelin sheath will be going for the degeneration. Okay? Now, it disrupts the saltatory conduction, which slows or blocks the nerve signal transmission. So, the myelin sheath work, the function of the myelin sheath is getting disrupted due to the damage, due to the inflammation of the myelin sheath. Going for the next point, leads to the neurological deficit of the transverse myelitis. Example, weakness, sensory changes, bowel bladder dysfunction. Okay, first stage is inflammation, second is demyelination. These things will be going for the weakness of the muscles, bowel bladder changes, and also the sensory changes. What will happen in the sensory changes? In the foot of the patient, they will be feeling the pinprick sensation, okay, or a burning sensation, or a stabbing leg sensation. So these sensations will be very worse at the night times. Okay, at the night times they will be feeling heavy sensations, all these things. Okay, understood? All the end parts of the foot will be going for the sensation. Now going for the third technique. It is the axonal injury. Already we discussed in the first stage itself, inflammation. It is inflamming the myelin sheath, and in chronic condition it is going for the axon changes. Now, what will happen in this axon? In severe or prolonged case. What is prolonged? Chronic case. In chronic case, okay? Now, inflammation will be extending its damage towards the myelin to the axons, leading to irreversible damage and long-term disability. What is irreversible damage? What is reversible? If something has happened, okay? So for example, if a bench is broken, for example, this bench is broken, we can give this bench to any of the mechanic or solder to reframe this bench. Yes or no? We can reverse this. Irreversible. For example, if a patient is having a fracture, we can reverse the process. We can heal the bone with the help of any surgery or the help of PO. When axons is going for damage in any condition, this will not be going for the reversible changes. It will not heal. Okay? It will lead to the complete disability. What is disability? Paralysis. Okay? paralysis of the arms and feet. These things will be most chronic conditions.